Okay, everyone, Dr. Charlie Johnson, physical therapist. This video is for you if you have been diagnosed with a disc herniation, or at least that's what you've been told, and you've been trying prone press-ups, okay, which are basically that thing that everyone kind of tells you what to do, or everyone recommends if you have a disc herniation. You see it all over YouTube, maybe everywhere else. You've been told that if you have a disc herniation, maybe you lay on your belly and you kind of do this cobra thing, right? So if you're doing these press-ups though, and it's just not working, you're wondering what the heck's going on, here could be what's happening, and here's what you're going to try instead. So in a previous video, I'll kind of link to that or just check it out. I talk about kind of why that exercise works, okay? And the reason it works is because, right, so the typical loss of motion in somebody who has a disc herniation, this is bending forward, this is bending backwards, this is to the left, this is to the right. We see that people really lose their ability to bend backwards and to one side. Maybe it be to the left, maybe it be to the right. But the point is that's because that's often where that disc material goes. So as I think I said before in a previous video, the majority of disc herniations come out the back and go to one side, okay? Because there's this thin ligament in the back, and it's kind of like a meridian when you're going down the road, right? So if you're going down the road and there's something in the middle, you're going to pick right or left, right? So that's what the disc herniation does. As we load the disc in the front, the material in the disc migrates towards the back. It has to pick because it can't go straight into that ligament in the back. It has to pick to the left or to the right. And you have an obstruction to whatever side, usually to whatever side you're having pain on. So in this case, if it's on the left side, you would be really kind of blocked in this back left corner. If it's on your right side, you'd be blocked in the other corner, okay? Point being is that these press-ups are great, right, because they try to basically capture that kind of herniation that might be out the back and sort of push it home, so to speak. But in some cases, okay, you will have an issue where that portion of the disc herniation is actually too far out to the side. So then actually doing these press-ups might actually make your pain worse, or you might actually plateau to a point where you're just not getting any better, okay? So if you're doing the prone press-ups and you're not getting anywhere, or you notice more pain, numbness, tingling down the leg, you might want to try one of these two things, okay? So here they are. Okay, so the first option that you have is that you can do a form of like shift correction to kind of get down on that one side to reduce the disc that way. And my head's probably going to be out of this, but I think you can see, okay? So what you're going to do is you're going to, let's just say you have symptoms on the left side going down the left leg, okay? You're going to stand, you're going to put your elbow on a wall, okay, to your right, and you're actually going to kind of stay up tall and push your hips in so that your hips are going to the right, your shoulders are going to the left. That's if you have pain going down the left side. Just reverse that, if you have symptoms down the right side. So you're kind of pushing the hips in if the symptoms are going down the left leg to the right, and you're clamping down on that kind of painful side. You're going to do that repeatedly, okay? Make sure you keep even weight on both legs. You're going to push, push, push until you feel the stiffness, all right? And you just want to ask yourself, as I do this, does the pain, numbness, or tingling feel the same, better, or worse? What you should notice is that the symptoms go from, say, the calf or the back of the thigh or the buttock, and they actually just kind of intensify or centralize in the lower back, okay? So that's one thing. It's kind of like a shift correction with your arm against the wall. If this is too intense because it's just too far for you to get to, then just put your shoulder against the wall, okay? Kind of like this. Standing up tall and then shift in. It's a little bit less range of motion required, okay? So that's your option number one. Option number two, let me show you. Okay, so option number two is just a slight variation of the press up, okay? What you're going to do is you're going to take that painful side, okay? Instead of just going kind of straight plane right into this cobra straight on up, you're going to actually take that painful side and hike that leg up. Kind of like, you would think like an army man crawling, or maybe asleep like this, something like that, okay? You're going to take that leg up, okay, and then you're going to try repeated press-ups. And the reason that this could work is that if that disc herniation is just a little bit off to the one side, okay, remember, you're raising up the painful leg, okay? So this would be for somebody who has problems in the left leg, okay? Right leg, just reverse it, right? Is that it actually kind of bends you towards that side. So it kind of clamps down on that side and allows you to get to a little bit more end range with regards to your movement, okay? So try that out for either of them. 10 reps, you just want to ask yourself, same, better, worse. If the symptoms in your leg feel much better, okay, and you just have pain in the back, good to go. If symptoms in the leg get worse or you notice your foot goes numb or something, stop, okay? But try the 10 repetitions and then sort of ask yourself, same, better, worse. Hope this helps, okay?